the things you do should look beautiful, and it is important for diagnosis purpose. Definitely it's important for marketing purpose, it's important for your malpractice safety, and it's rewarding for yourself. So it's something your photography should be very good, so that it gives you a lot of satisfactions, right? um, and even it look professional when you do your job. So why we need photos, as we discussed, it help in patient education, because if you treat something, it become tool for you to present it to the second patient. It gives the patients comforts that you already know the problem and you have gone through it, so they can trust you well. So in starting a new practice, make sure from everything do photography. There are thousands of photos which are not useful, but what I tell you now is everything on a cloud. So get your good storage of clouds and try to take as much photography as you can. And over the period of time, when you become old, each photos, you know where to place and how to place. Okay. So whatever photography you are doing is not useless. Everything will work for you at any stage. When you do the clinical cases, every day, every patient picture you can take, you will feel at some point that why I'm taking it's just not moved. But when you see a complete case, you will see the difference, how it moves and what difference every visit has made for you in your photography. So without asking any questions, just follow the rule that whatever work you do, take a picture before doing, after doing, and then save it in a place where you can retrieve it. So save it always in a digital format in a cloud, okay, or in a Dropbox. That is the best way to do it. So you know that where to place it, how to place it, because if you're putting in the computer or any hardware, make sure you have a backup always ready. It also helps in a clinical investigation of especially how the craniofacial structures are, how the dental relationships are. It helps you to discuss your case with your peers and asking for the expert opinion. It helps to self-check your progress by comparing pre and post treatment, by looking at the progress pictures. It helps to document the patient condition before starting the treatment, which save you from liability concern, especially in braces. There is a lot of liabilities like damage of the gingiva, damage of soft tissue, white spot legend, cleft damage during treatment, change of the facial features, especially in the surgical orthodontics. So it's very important that every facial asymmetries become either more prominent or will become a worsen or get better in either of the condition. Progress pictures should be taken. It also helps you to teach your peers by giving lectures, case presentations for marketing, for international presentations, okay? And whenever you utilize it publicly, then make sure you take a patient consent. So when you're taking the pictures, you should keep the consent form for sharing the pictures to the publications and social media available. So you don't need to go back to the patient and ask them for that. Try to avoid patient face pictures wherever you are using it for marketing purposes. Just save you hassle unless you have a clear social media consent form ready. So for good photography, there is certain requirements how you can do. These tools are very important. You should have a good camera system. Today's smartphones are good, but they are not perfect. They are not what needed actually, because when you go for the publication, they need a certain macro lens requirement. Some pictures which are not printable, so your whole treatment would not be considered for publication if your photographs are not of clear dimension. So clinical pictures as a rule should be taken with professional camera. Other pictures, pictures for marketing, pictures for social medias, you can take from your phone. But when you document it, anything should be in a process, in the old fashioned with a camera system, with the retractors on all the time. Don't use the fingers. Retractors are the very cheap nowadays. You can just get it from Amazon or somewhere from the suppliers, but make sure the retractors, mirrors, the oral mirrors, they are compulsory things, and a good lighting system. I usually don't keep any, I don't focus on the last part, because when I designed my clinic, I have put a very big light on the top of the dental chair. It's a white light, and I have a window in front, and I always switch off my dental clinic light. So if you have a good lighting in a clinic place, you don't need additional lighting, photographic lighting. Your camera will set up for it. Okay. So coming to the camera, what camera you want. And you should need it. So there are three types of camera. The one is normal camera, digital cameras, which we don't use. The other ones are semi-digital, and the third one are DSLR. Okay, so DSLR are one where the lenses can be removed and put on. They are highly professional cameras. They are the camera, actually, we should use it. Okay, but there is an option, you can use semi-digital cameras. Okay, now the semi-digital one, they have a lens which is can't be removed, but they have a wide lens, like macro up to certain extent, that you can use it with confidence. So personally speaking, if you're doing any aesthetics work, like you want to see the difference in the shade and shade, where you need a certain lighting condition to compare pre and post, then it is important that you use DSLR. Okay. But when you're doing the orthodontics, where you are not dealing with a shade issue, okay, your requirement will be fulfilled with the semi professional cameras. Okay, in which you have a good lens, but the lens can be attached. Now, why I'm telling you to buy the mid-range, because I personally use a mid-range. I never use DSLR because I never find the need for it. And the one which I use is Olympus one, the company which is Olympus. And it has a battery, and it is a very big zoom and the macro lens, which I needed. And for the pictures which you printed are appropriate quality that can be accepted in any international publication. And it is very quick to use. You don't need to remove the lens, do anything. It is like one camera with everything. And it gives you very perfect result. I can share with you what I'm using it. You can even use the Sony as well, and you can use the Nikon. So in our residency, what we have been recommended was the Nikon. Okay, but Nikon semi-adjustable was the gold standard at that time. Then the technologies have changed and the other cameras have come into the place. So when we came, we have an option of Olympus and Sony. So I bought the Olympus. It is very economical and it's easy. The only problem which I find with my camera is that I have to use, it doesn't have a battery. It has a rechargeable cells. So every time after a few years, the cells become bad, and then I have to buy new recyclable cells. And each cells, I need to take it out and charge it. If you have a battery, it's everything will charge in one go. So that's the only difference. But in terms of quality, it is good. Now, coming to the macro lens, it is always good that it's more than 90 millimeter. Now, this is 90 millimeter you get only in the DSLR, okay? In semi-professional, I think I have 30 millimeter one. And macro lens is for zoom and focus, okay? The more you want focus and zoom photography, you need a macro lens. So for aesthetic reasons, we need a very good macro lens. For now, we are dealing not with a mini aesthetics, we're dealing with the macro aesthetics, in which we see the alignment of the teeth and the cross movement of the teeth. So even the 30 millimeter macro lenses also work very nicely. Okay, but if you're already in a position that you expose yourself to the DSLR and you are very ready to learn, then try to learn using this camera. It gives you awesome results. They have, and always you need to have a good flash. The ideal flash is ring flash. You put it in any of your camera system. It's something detachable that you can buy and put it up. Then there is an automatic flash, which usually it says should be avoided, because in an automatic flash, there is a shadows come on the side. So you need a very good lighting on the side. Then you can use automatic flash. Otherwise, the ring flash is the ideal. Um, the camera should have an internal flash, which is not present in our cell phone, or it's not present in the digital camera. It's only present in the semi-professional and professional cameras, which is called as red light. This internal flash gives the beautiful result. So this, we get it in the Olympus Ren. Then we have a studio light. It depends. If you have a very good lighting in your clinic, you don't need a studio light, but you can always have it if you want very beautiful pictures with no shadows. So to avoid shadows, we need a studio light. But if you can manage and you have good skill with photography and you know how to manage your shadows by playing with the light sources available, then you don't need all this expensive stuff. Okay, and always you have to do photographs in the daylight, not in the with a dental chair light. Okay, also your camera system should have a manual f-stop and the manual focus. So this f-stop is a f length, focal length, that you can adjust it what length you want, and the manual focus should be there, so you know how much to zoom or not to zoom. So what is it? You can see what is the f-stop and what difference does it make. So greater the depth of the focus, the greater the details you can see. So how you get this f-stop? By having a macro lens. So your camera should have a manually, you can zoom in and zoom out to adjust the f-stop. So if you see here is 2.8, it's not giving you detail. In 8, it's not giving you detail, but in 22, the higher it goes, the better details you can see. So we need a camera system with a good f-stop, at least of 22 millimeter, okay? Now this is the way you can see the extraoral way, okay? If the f-stop is less, then you see the picture like this. The same person, you see the face look suddenly too out. And as you increase the depth of focus, you get the correct image of the patient, okay? So f-stop should be, the higher it is, the better is it. So at the focal length of 135, your pictures looks much better. Okay, then you need the retractors. The retractors you're going to buy should be like this, in which there is a very wide retractor and other end is a very narrow retractors. When you take the pictures, you always use the wide end. When you put this into a patient mouth, they will complain that the cheeks are stretching here, it's hurting. Then you inform the patient and do it very gently in a way that you not hurt the sulcus, but you need a full stretch to get the mucogingival junction pictures, okay, and all the frenum attachment. So it should be the full mouth visibility for orthodontic pictures. Then you have a lip retractors. The lip retractors, you use it when you take the orthodontic occlusal photographs. So there are two ways of doing occlusal photograph. You can do the lip retractor one, or you can use the two cheek retractor in the upward or downward motion, okay? Then you need an intraoral mirrors. So there are different types of the mirrors. Now this mirror is a stainless steel mirror in which is both sides are reflected. Okay, they have a different shapes. So this shape you can use in the adult with a wide jaw. This one you can use in the kid, and this one you can use for the buccal photographs. So indirect buccal photographs, you can use this mirror. Okay, what is the benefit of using the stainless steel mirror is it can't be break. So if it's dropped, it's not an issue. It is inexpensive and it can be sterilized with autoclave. What is a problem with this mirror is only scratches. So after 2 or 3 use, you will feel that there are too many scratches. So when you buy such mirrors, you have to tell your assistant that don't keep it with all the instruments and go into the wash. When you get the mirror, you wash it, dry it, and clean it separately and pack it. Okay, and don't mix it with probes and other instruments because it can get scratched. Okay, so you just need to have a special instructions to keep the life longer, but anyways you will get scratches over the period of time. Why we want this one, the polished metal one, because whatever you see is a real image. Okay, so it's a very true visibility. The other type of the mirrors are called rhodium coated mirrors. These rhodium coated mirrors have a very good optical properties, like you can take the best photographs. Okay, but the problem is with the rhodium coated mirrors are it is breakable, it is very expensive, and you can't sterilize them. You can see it here, the tips are metal. Okay, you always can do the spray disinfection only. So when you do the spray disinfection, it happened that sometimes the patient have a disease, which we now in COVID, we have to be very careful that everything either disposable or go to the autoclave. So rhodium coated mirrors are not worthwhile to spend just to get a very beautiful photographs. Then you have a glass mirror face mirrors. Never buy these ones. The reason is that they look good when you see them, but they are very cheap. They can break, okay? And they always give you a distorted picture. They don't give you the accurate reflection of the face. So the mirrors, what we use in the house, is called as for our dressing table, they are glass mirrors. These mirrors are not be used for intraoral photography. And the reason why they can't be used, because whatever light they go, they come out with a different distortion. It not come out 100% what the image is. It come out as distorted. Okay. Now coming to the intraoral photograph, these are 6 photographs that you have to take it for every patient. First photograph is your front picture with full stretch. You can see all the frenum, and the right side and left side should be equally exposed. Then is the overjet picture. Then there is a buccal 2 picture and occlusal 2 pictures. We go in detail. So for intraoral photograph, according to American Board of Orthodontics, there is a requirement. When you want to present into the American Board of Orthodontics, there is a certain requirement for your pictures. Otherwise, they will not accept it for recognition purpose. And these requirements are very nice to learn because this help you to build your skill on the right platform. That, you know, my pictures should be up to that level, so it can be accepted in any journal, and it can be published with confidence, right? So the guidelines is that your picture should have a quality print, should be standardized, and should be colored. Okay. The patient dentition oriented accurately in all 3 planes of space, one frontal view in maximum intercuspation, two lateral views right and left, optional two occlusal view of the maxilla and the mandible. They are free of distraction by using there should be no retractors or labels or finger in the picture. The quality lightning, which relieves anatomical contours and makes the image free of shadows. The tongue should be retracted when you're taking the lower mandibular jaw. The pictures should be free of saliva and bubbles, and the dentition need to be clean. So always remember, when you're taking the pictures, always do the scaling, polishing first, restoration first, and then you take the patient records. Then what is the process? You have to take the consent of the patient for any photography. You have to seat the patient on the dental chair, ask them to lean it in at the back, and then your camera should be at least 20 centimeter distance, and you can do a test trial, just a image to see how clear and sharp the image is coming. And then you do the particular uh, pictures with retractions. So the position of the camera is there. You can do the occlusal pictures from the top, and then you can do the lateral view and the frontal buccal pictures and the frontal pictures while coming in front of the patient. Okay, you always need an assistant who can help you out to retract the cheeks with precision. If you don't have a dental assistant, then the patient sometimes help you, but then they can't stretch their lips. So you have to train patient by showing them in the mirror how you want it to be stretched, or you can have a trained assistant who can help you out.